There's some new sleep research. This is from Brigham and Women's Hospital that looks at the habits of night owls versus early birds. So here to walk us through everything we need to know is sleep expert from RWJ Barnabas, Dr. Carol Ash. Good morning to you.
Good morning.
So we were all talking about this. Some of us have spouses who just we call them night owls. They stay up late, and then others are regimented. They go to bed. I always thought it was just a behavior. I didn't realize there is a genetic factor to maybe people are just predisposed to being night owls.
Yeah, it's actually genetic. So what we know is the chronotype is your tendency for bedtime and wakefulness. So we talk about the circadian rhythm. That's the day-to-day cycle of sleep and wake and the release of hormones and neurochemicals that control that cycle. And your chronotype is your response to that release. So it's either delayed with a delayed bedtime or early with an earlier bedtime. So delayed, the owl, and earlier, the lark.
So if there's the night owl and the early bird, how do those impact your lifestyle? I mean, your day-to-day?
Well, day-to-day, we've known for some time that if you're a night owl, you have health risks. So you could have an irregular sleep schedule that could lead to depression.
Look at these.
Yeah, insulin resistance. You're less likely to have healthy behaviors. You're less likely to exercise, and your diet will be unhealthy. And when you're talking about lifestyle, the night owl tends to have more energy at night, and they're bigger risk takers, and even tend to be single. So there are personality and performance associated with being a night owl.
Dr. Ash, so going back to what you just said about the risk of diabetes and other medical concerns, if you are a night owl, how do you reduce the risk?
Well, see, you have to understand your type. So, and how do you know what your type is? Well, think about it. Where do you have more energy, later in the day or in the morning? What is your bedtime? And then what you can do is adjust your lifestyle to match that preference. So, exercise earlier in the morning if you're a lark, if you're a night owl, later in the day. And be mindful of the fact that maybe your job doesn't align with your work, because what they found in that study was the night owl RNs that worked during the day shift had a 19% increased risk of diabetes, and when you added in unhealthy behaviors, it increased to 72%. So focusing on healthy behaviors, diet, exercise really matters.
And this was a pretty large study. I mean, I think they looked at data from more than 60,000 female nurses, and the nurses were on different schedules. So it's not like they're trying to not have a healthy lifestyle. It's just, it's the shift. And really quickly, there was another study that found a healthier lifestyle can help prevent depression.
Yes, well, like I just said, the night owls have an irregular sleep schedule that can lead to depression. And that study showed for all of us that diet, exercise, avoiding tobacco and alcohol, and not too sedentary lifestyle can really improve your mood and reduce the risk of depression. So healthy lifestyle.
Good sleep. Thank you, Dr.
All the things we know, we just now have more studies to prove.
Now we have to do it.
Correct. Dr. Ash, thank you.
Oh, you're so welcome.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.